Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director for the National Registry of EMTs. And in today's episode, we're going to be talking about EMS clinicians and behavioral health, specifically about a novel study that's going to be looking at using technology to better understand the dynamics of the stress related to EMS on EMS clinicians. Joining me for today's episode is Enzo Plaitano. He is a National Registry Paramedic, and also he is a PhD candidate at the Dartmouth College Institute for Health Policy and Clinical Practice, as well as a predoctoral fellow for the Center of Technology and Behavioral Health. So Enzo, thanks for joining me today.
Yeah, thanks so much for having me, Bill.
So tell us a little bit about yourself, your background. Obviously, I say you're a paramedic and you're a PhD candidate and you're undertaking this novel study. So tell us a little about your history, your background, your story that got you here.
Yeah, absolutely. So I've been an EMS clinician now for almost 10 years. It started quite serendipitously when I was in high school. My father wanted me to join the local ambulance service, and we decided that would be a great kind of career exploration type of pathway. So I started as an EMT, and I just really enjoyed working and taking care of patients and meeting a bunch of people in the community. I had a really fond interest too in kind of behavioral health and how people approach different behavioral concepts. So I went to college at Boston University and studied behavioral neuroscience, which really kind of piqued my interest into the behavioral health problems going on all across our country. And really what I was most fascinated with as working as a EMT and now as a paramedic and studying this was really the stressors that were being put on EMS clinicians. So kind of the job is inherently stressful, and a lot of different factors are making it even more stressful for us. So what I wanted to do was study kind of how different stressors are impacting our ability to regulate our emotions and impacting our behaviors. And that's really what led me up to Dartmouth College, where I'm now a PhD candidate in the Center for Technology and Behavioral Health. And our really kind of big push is to understand different risk factors for health risk behaviors and developing digital interventions to kind of intervene and help people manage their own health and well-being.
So quite a journey in 10 years for you. That's
yeah, it's been quite busy for sure.
Well, and I think, I'll speak for myself, but I think that your focus on this topic that you're looking at, which I want to get into a little bit more, of course, is desperately needed. And especially, it was bad pre-pandemic, but I think it's gotten worse as it relates to behavioral health, the stressors related to the profession, the job. There's a lot of internal and external stressors, and being able to understand this in real time, I think, is critical, so we can get to not only the root causes, but ultimately to mechanisms to help the EMS clinicians that are experiencing stressors related to the job.
Yeah, absolutely, for sure. So, yeah, what's really great about what we're doing here is there's a lot of studies that are kind of looking at these relationships at one point in time. So delivering one survey at one point in time to really figure out how stress might be related to different health risk behaviors. Well, we're taking a different approach, and it's called ecological momentary assessments, where we're deploying multiple surveys throughout the day over a course of a longer period of time. So over a whole month, where we're really able to see how these really small changes in people's stress levels are impacting their health risk behaviors and their overall well-being. And what's really great about this is we're able to look at this across large periods of time to see how maybe somebody experiencing a little bit more stress than usual is predicting kind of changes in their coping strategies. Or we can also see how people experiencing larger, kind of more acute stressful events is impacting their health and well-being. So it's really allowing us to take a real world approach and look into different times throughout the day and understand this at more of a real world type level, which is really fantastic.
And longitudinally too, which, as you said, I don't think has been done from a behavioral perspective at all for EMS.
Yeah, absolutely. And we got a lot of feedback from folks and different facets of EMS, really about the idea of doing these small surveys while people before a shift, while on shift, after shift, and kind of the utility of being able to do that. And what's been really interesting about it is we're able to do just that and see, how people's levels of stress before a shift might impact their health risk behaviors either during or after, and how people kind of cope with their stresses during shift and after shift. And really, when you just deploy one survey at one point in time, you're not really able to see kind of those dynamic changes and really kind of understand the risk factors people are facing in these real world environments.
So what other evidence is out there to kind of support the stress levels for EMS clinicians that kind of, as you told your story, as far as where you got here, what other evidence is out there? What's published out there as it relates to EMS and mental health or behavioral health?
Yeah, absolutely. So again, most of the studies out there right now are cross-sectional. So they're, again, just kind of one point in time. What's really tough about this is we're not able to determine directionality. So it's hard to say what came first and what's really predicting other kind of constructs. So really what we're seeing right now is there's a lot of studies in general samples of first responders. So in larger samples of EMS clinicians, firefighters, and police officers together that are suggesting that higher stress levels are related to more health risk behaviors. This might include substance use, less exercise, not really eating as well, kind of those types of relationships. But again, we're only able currently to look at this at one point in time when really our study's allowing us to kind of look at it throughout different days and different time periods. So mostly it's just a lot of relationships between higher stress levels and higher risk factors for these health risk behaviors.
Very cool and very interesting. Curious to see the findings. What's the study saying? So
Yeah, absolutely.
The National Registry is collaborating with you on this, our research team. We're happy to do that. It also relates to the longitudinal study that we're looking to undertake hopefully soon. That is going to look certainly at behavioral health, mental health. So this plays right into that, but also at the other risk factors because of the high stress, cardiovascular risks, other behavioral potential risks there, as well as cancer. So there's a lot of aspects that we're looking at with this. So I think this is a nice kickoff in terms of research and study for the profession, which it desperately needs, because we need to better understand and take care of the clinicians that are out there in the trenches day in and day out, because it does wear on them very much.
Yeah, absolutely. And we're really, what's great is we're kind of all on the same page here, really trying to look at these relationships in real time. And our real goal here, and my real goal of my career, is to develop a digital health intervention specifically for EMS clinicians. So really trying to identify predictors of different health risk behaviors and where we can actually intervene. So really kind of the big idea here is if we know that stress impacts health risk behaviors, and we know that EMS clinicians have really high levels of stress. But what's really tough is the job is inherently stressful. There's a lot of stressors that we just can't remove, and a lot of these kind of big policy changes that would have to be made. So really on our end, what we're really interested in figuring out is how stress kind of can predict and be related to these more behavioral factors that we can actually change. So what I'm really particularly interested in and what our study is looking at is how stress levels, so variation in stress or having higher stress levels than usual, can predict emotional regulation and self-regulation behaviors. So how well an EMS clinician can actually regulate their own behavior during a shift, and then how this relates to different health risk behaviors. And what's really fantastic about this is if we identify that there is this kind of three-pronged relationship between stress, self-regulation, and then these health risk behaviors, our digital intervention can actually target self-regulation to decrease people's kind of health risk behaviors. So while we actually really can't target stress particularly, we can actually target what stress impacts to then have people be a little bit more healthier and kind of be able to self-regulate their own stressors of the job. So that's kind of really what our goal is here. And that's kind of our theme for intervention development.
Cool. Very, very interesting. Like I say, desperately and definitely needed within the profession. So where are you right now as it relates to picking up the study? It's launched, and how big is it? How long is it going to take? And curiosity and eagerness. When are we gonna see the publication of the dissertation?
Yeah, absolutely. That's a fantastic question, and one that I always enjoy talking about. So we've been very fortunate to get NIH funding for this study. So with Ash Panchal, who's the research director at the National Registry of EMTs, as well as my mentorship here at Dartmouth College, I applied for a big NIH research fellowship all the way last year, and we found out it was funded, which is really exciting. So that gave us some funding support for me to do this study. And we also got a pilot grant through our Center for Technology and Behavioral Health here at Dartmouth, which is allowing us to pay for the platforms and to pay participants for enrolling and participating in the study. So now that we had all this grant funding, we actually kicked off the study last month, which is really exciting. So we need 110 EMS clinicians from across the country to enroll, and we already have over 90. So we're almost about 85% complete. And people have just really been eager to enroll and eager to help. And again, our big idea here is we want our results to be representative of EMS clinicians from across the country. So we've really been pushing to enroll EMS clinicians from the West Coast to the East Coast, all different states, to really kind of have a representative sample. And the National Registry has been very helpful in allowing us to do that, and allowing us to really make sure that our results are, again, representative of EMS clinicians nationally. And we're really quite close to finishing data collection, and we're hoping kind of to get the paper out maybe later this year.
Oh, wow. That's pretty quick.
Yeah, absolutely.
Where can people find more information about this online, or how can they follow you, or how can they track this? And if you're still like needing 20 more people, how can they find out about an opportunity to potentially volunteer to be part of the study?
Yeah, absolutely. So we've been recruiting people from a lot of different resources, which has been very helpful. Again, the National Registry has been a huge help and a huge push. So we did a cross-sectional study with Osh and you all last year, and we ended up recruiting over 2,000 EMS clinicians using your survey distribution platforms. And what was really, really exciting is out of these 2,000 people, 1,500 left their email address to be contacted about this future study. So we had an item in there that asked if people were interested in enrolling in our other studies, they could leave their email. So a vast majority of people actually left their email, and we are enrolled a large amount of them in this study, which is really exciting. And we've also had really great buy-in and interest from state EMS offices. So we've been contacting state EMS offices from around the country, and we've actually had a few contact us that have heard about our study actually through you all. And they have been doing just a very great service to us of disseminating our study and our research information to their EMS clinicians and agencies across the country. So we've had very good reach, and we're really interested in getting those last 20 people and really having enough power and statistical power in our study to really detect these relationships and figure out what we can target to help improve people's health and well-being in the future. So kind of going through the National Registry, going through these state EMS offices, and then if people are interested, they can always contact us directly here at Dartmouth, and we can screen them and see if they're interested in enrolling.
Cool. Awesome. Well, any other thoughts on the study and kind of your journey?
Yeah, absolutely. Yeah, for sure. Yeah. So really kind of, again, like the big idea here is to develop these interventions for EMS clinicians, and kind of what we really were thinking about when we started this, and when I talked with Osh and the NREMT folks, is that there are several apps on the marketplace that are kind of for stress management. And there's a few actually on the marketplace that are tailored to kind of first responders. And what we're really trying to do is take kind of this data informed approach to design a data and a digital intervention. So really taking a step back and trying to understand, what are the predictors of these health risk behaviors and health and well-being? And in that pathway, what are some other targets that we can actually kind of improve through a digital health intervention? So instead of just designing an intervention that kind of has all of those components that people typically incorporate, taking a step back and really trying to figure out what makes EMS clinicians special, what are kind of the problems that we're actually facing on this day-to-day level, and what can we kind of build into an intervention that can actually help specifically EMS clinicians. So my favorite line that I typically use is, we're trying to develop an app for EMS clinicians by EMS clinicians. So really, I think what's so exciting about it is we're giving folks from across the country the opportunity to enroll in this study, be part of it, and really contribute data that will allow us to kind of improve the overall health and well-being of our peers and of this entire group. And that's really what we've been seeing is people have been enrolling, they've been participating, and people have really seemed generally excited to be able to be part of something that might change the profession and improve themselves and their peers. So it's been a long journey. It's been a busy journey, but it's just been so fulfilling and exciting, I think, to see people step up to the plate and be part of this and contribute data that's going to allow us to build an intervention to really improve health and well-being of the whole EMS community. And that's really what our goal is here.
That's really admirable. And, I think I speak for every other EMS clinician out there. Thank you for what you're doing. It is definitely needed and desperately needed. And your work and the insights you gave your study, I think will pay multiple dividends back to the community. We both love and adore, and that's always key. So thank you for what you're doing, Enzo. I really appreciate it. And thank you, of course, for taking time with me today.
Yeah, thank you so much. It was great to chat with you and catch up about the study and the progress that we're making together, really, to improve the health and well-being of the full EMS community.
Awesome. And thank you also for joining us for today's episode. And as always, stay safe.
Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nrmt.org. Thank you very much. And again, stay safe.